10 common medications that can cause dementia. Many people use medicines for common problems like sleep or allergies, yet studies link them to higher memory loss risk with prolonged or high-dose use. This doesn't mean everyone who takes them will get dementia, but caution helps. By the end, you'll learn which medications to avoid or use carefully. Have you asked if your everyday pill affects your future brain health? Dementia can worsen memory and thinking, and some drugs may speed that up. Always consult a medical professional before making changes to your medications. The first group is called anticholinergics. These medicines work by blocking or reducing a brain chemical called acetylcholine, which is important for learning and memory. You might be taking anticholinergics for allergies, like diphenhydramine, often sold as Benadryl, or for problems like motion sickness or an overactive bladder. Some sleep aids also have anticholinergic properties. Studies have found that using these drugs often, or in higher doses, can lead to memory issues over time. Older adults seem to be especially at risk because their bodies do not break down the medicine as efficiently as younger people do. If you see words like anticholinergic on a medication label, or if you notice you feel more forgetful when taking a certain drug, it is worth asking your doctor about other options that are less likely to affect your memory. Next, we have benzodiazepines, which are often given to people who have anxiety or insomnia. Examples include alprazolam, Xanax, and diazepam, Valium. These medicines help calm down the nervous system, making it easier to relax or fall asleep. However, several studies suggest that long-term use of benzodiazepines might raise the risk of memory problems, especially in older adults. One reason is that as we age, our bodies take longer to remove these drugs from our system. This can cause them to build up and lead to confusion, drowsiness during the day, and even higher chances of falls. If you have been using a benzodiazepine for many months or years, you might want to talk to your doctor to see if there are safer ways to manage anxiety or sleep problems. We also have a similar group known as Z drugs, which are non-benzodiazepine sleep aids like Zolpidem, Ambien. While they are not the same as traditional benzodiazepines, they work in a similar way by boosting chemicals in the brain that slow down activity, helping people fall asleep. Over time, these medicines can also lead to confusion or memory issues, especially if taken for extended periods. Many doctors suggest using these drugs only for a short while. If you have chronic insomnia, it may be better to try lifestyle changes, such as avoiding caffeine before bed, keeping a consistent bedtime routine, or trying relaxation exercises. Some people find success with cognitive behavioral therapy for insomnia, which can help them sleep better without the long-term risks. Our fourth group of medications is proton pump inhibitors PPIs. These include drugs like omeprazole, Prilosec, and esomeprazole, Nexium, which many people use for heartburn, acid reflux, or stomach ulcers. Some research points to a possible link between long-term PPI use and a higher dementia risk. One theory is that these medicines might change how the body absorbs vitamin B12, which is important for healthy brain function. Another idea is that they could alter bacteria in the gut, and in turn affect overall health, including the brain. If you have been on a PPI for a long time, especially at a high dose, it might be worth asking your doctor if you can reduce the dose or switch to a different treatment for acid reflux. Tricyclic antidepressants are our fifth group. These are older antidepressants, like amitriptyline, nortriptyline, and imipramine, which also have anticholinergic effects. They can be very helpful for people with depression or chronic pain, but they may raise the risk of confusion and memory issues in some users. Because of their anticholinergic properties, they can block acetylcholine, just like the first group we talked about. If you have been on a tricyclic antidepressant for a while and notice forgetfulness or brain fog, you could ask your doctor about switching to a newer class of antidepressants, like SSRIs, that typically have fewer of these side effects. Sixth, we have antipsychotics, such as risperidone, Risperdal, or olanzapine, Zyprexa. These medicines treat serious mental health conditions like schizophrenia or bipolar disorder. Sometimes, they are given to people with dementia who have severe behavior problems. However, experts worry that antipsychotics can make cognitive decline worse in older adults and may raise the risk of serious side effects in people already diagnosed with dementia. If someone you know is on an antipsychotic, it's wise to keep an eye on any changes in mood, memory, or overall functioning. Talk to the doctor about whether there are safer treatments or ways to reduce the dose, especially for older individuals. The seventh group is statins, used to lower cholesterol. Common examples are atorvastatin, Lipitor, and simvastatin, Zocor. While statins are important for preventing heart attacks and strokes, which themselves can cause a type of dementia called vascular dementia, some people have reported problems with memory or feeling mentally foggy after starting a statin. Research results have been mixed. Some studies suggest a link to memory issues, while others show that statins might protect against cognitive decline by improving blood flow in the brain. If you're worried about mental clarity while taking a statin, discuss it with your doctor. They may lower your dose or switch you to a different type if necessary. Never stop taking a statin on your own, since controlling cholesterol is important for heart and brain health. Eighth on our list are anticonvulsants, such as phenytoin or topiramate, which help control seizures. They can also be used for mood disorders or nerve pain. In some cases, these medicines can cause slowed thinking or brain fog, particularly if the dose is high or if the person taking them is older. You may not see memory problems right away, but long-term use could lead to subtle cognitive issues. If you notice changes in how quickly you can process information or remember things after starting an anticonvulsant, it's a good idea to talk to your doctor. They might adjust the dose or try a different medication that has fewer side effects on the brain. Ninth, we have antihypertensives, blood pressure medications like beta blockers. Keeping blood pressure in a healthy range is key to preventing strokes, which can lead to vascular dementia. But some people find that certain blood pressure drugs make them feel tired, lightheaded, or mentally sluggish. If you have recently started a new blood pressure medication and notice that you're more forgetful or less alert, mention it at your next doctor visit. There might be a different blood pressure drug or a lower dose that can still keep your numbers in check without affecting your focus. 10th are the over-the-counter sleep aids and combination pain relievers that contain antihistamines. For example, products like Tylenol PM or Advil PM mix a pain reliever with an antihistamine, which makes you drowsy. While these can help when you have occasional trouble sleeping, using them too often might lead to confusion, daytime drowsiness, or longer-term memory issues, especially in older adults. Because these products are easy to buy, many people do not think of them as harmful. If you have been using them regularly, check with a doctor to see if there is a safer way to manage pain or get better sleep. Now, if you use one or more of these medicines, do not panic. It does not mean you will develop dementia. However, staying informed is wise. Talk with your healthcare provider about whether the benefits of your current medications outweigh the risks. Sometimes a lower dose can work just as well with fewer side effects. Other times, a different drug may help your condition without increasing your chances of memory problems. If you find this video useful, please remember to like, share, and subscribe so others can learn about it. Next, let's discuss why these medications might affect your brain. As people age, the blood-brain barrier, which usually protects against harmful substances, can weaken. This means more chemicals from medications can enter the brain and cause problems. Many older adults also have slower metabolism, so these drugs can build up and lead to confusion or memory troubles. Some medications affect neurotransmitters, the chemical messengers in our brains. For example, anticholinergics block acetylcholine, which we need for learning and memory. Too much blocking can cause forgetfulness or disorientation. Benzodiazepines and Z drugs raise GABA, a calming chemical, but too much sedation over time may reduce alertness. If someone takes multiple drugs that influence the brain, these effects may combine, raising the risk of dementia-like symptoms. Genetics can also play a part. Certain genes make individuals more prone to dementia, so adding medication effects could increase memory problems further. Health issues like diabetes, kidney or liver disease, or past strokes can weaken the brain too, and certain drugs might speed up cognitive decline in those cases. What can you do if you're worried about these effects on your brain? First, review all your medications with a doctor or pharmacist. Include prescription drugs, vitamins, and over-the-counter items. Ask if each one is still necessary. Second, try non-drug methods for common problems, like better sleep routines or counseling for anxiety. Third, inquire about safer alternatives if you're on high anticholinergic medications or long-term benzodiazepines. Fourth, adopt healthy lifestyle habits. A balanced diet, regular exercise, and mentally stimulating activities support brain health. Fifth, monitor your vitamin levels, particularly B12, and get regular checkups. Detecting memory changes early can help you manage them sooner. Let's return to our initial questions. Can everyday pills affect your long-term brain health? And why might older adults become forgetful when they otherwise seem healthy? Certain medications, those with sedative or anticholinergic properties, can hasten memory decline, particularly in older people or those with multiple conditions. This does not mean you must stop using them immediately. Many individuals need these drugs for important reasons. The key is being aware of potential risks, discussing them with a professional, and exploring safer solutions whenever possible. Always consult a healthcare provider before stopping any prescription, especially benzodiazepines or antipsychotics, as stopping abruptly can be harmful. Thank you for watching, and please like, share, and subscribe to spread this information. Dementia involves many causes, but learning about medications that may affect memory is a smart way to make better decisions.